A ventilator is a machine that takes over the functions of breathing for patients that cannot breathe on their own. The ventilator is connected to a tube that is inserted into the patient's trachea in order to manually ventilate for them. Ventilators use positive pressure to push air into the lungs, in comparison to normal breathing where negative pressure is used to inhale oxygen into the lungs. As a nursing student, you'll need to understand the basic settings and what they mean. Tidal volume is the volume of air that is delivered to the patient with each breath. FiO2, or fraction of inspired oxygen, is the oxygen concentration of air being delivered to the patient. PEEP, or positive end expiratory pressure, is the pressure maintained at the end of each exhalation. This is used to prevent the alveoli from collapsing and to improve oxygenation. And rate refers to the number of breaths per minute that are delivered to the patient. Let me know if you'd like to learn more about ventilators and check out the full study sheet in the Nursing School Success Bundle.